Next, we would like to invite Dr. Karishma Tendulkar, who will be speaking on breaking barriers, evaluating macular edema on portable, low-cost, high-performance spectral domain OCT. Dr. Karishma, please.
Thank you, sir. Good morning, respected judges. Good morning, everyone. I'm Dr. Karishma Tendulkar from Narayan Nethralaya, and today I'll be discussing the utility of a portable, low-cost, high-performance ST-OCT in evaluating macular edema. As we know, the OCT is an indispensable tool for every ophthalmologist today. From its inception in the 90s as a time domain OCT, it has undergone several reiterations and improvements to its current form as the SSOCT. However, in spite of these technological advancements, we see that there is a limited access of this technology to people in rural areas and camp settings. This could mainly be attributed to the high cost and the bulky design of the OCT machines. So how do we overcome these challenges? With this in mind, we at Narayan Nethralaya, in collaboration with Artelius Bangalore, came up with a low-cost, high-performance ST-OCT with an inbuilt retinal layer segmentation software. So this has a handheld OCT which is mounted on a chin rest stand. It comes with a console and a touchscreen laptop with a Wi-Fi and USB which enables sharing of the data from secondary referral centers as well. So it's literally an OCT that can be carried in a bag. It's only 3.9 kgs. Coming to the technical specifications, it has an axial resolution of 5 microns, a lateral resolution of 19 microns, depth of imaging of 2.7 millimeters, and a wavelength of 840 nanometers. So this, as we can see, is comparable to the Spectralis Heidelberg, which is the standard OCT, SD-OCT that we use, and we use the same machine to validate our machine against. And you can see with all the specification, it only weighs around 3.9 kgs. The system also, we also developed the retinal layer segmentation software along with it. So what it does is it can delineate the retina from the ILM to the RPE. This is an OCT report from the machine. So with this, we carried out a study. It was an observational, cross-sectional, comparative study in 50 eyes with clinically diagnosed macular edema. Of course, we excluded the eyes which had media opacities or fixation problems like nystagmus or squint. And we carried out the scanning on, we carried out the scanning on, So we carried out the scan on the two machines and compared the results. So what did we find? We basically evaluated the two machines on the image quality and the macular edema parameters. As you can see, the images on both the machines, the one on the right side of the screen is the LCHP and the other side is the SD-OCT. And we can see that it's comparable. We also saw that the retinal layers were very well delineated. As we can see in the first image here, the retinal thickening is seen. There are hard exudates that are seen, and also we can see the photoreceptor layer disruption. In the second image, we can see a pigment epithelial detachment. We could also note a few OCT biomarkers like drill changes, that is the disruption of the retinal inner layers in the picture that you can see, the red arrow above, and subretinal fluid. The VR interface abnormalities such as in ERM and VMT were also well noted. However, there was limited visibility below the RPE. As you can see, the Spectralis image shows a better imaging of the choroidal vasculature as opposed to our machine. Also, the machine did have a few additional artifacts because of which the imaging was not very good quality. However, the macular edema parameters on our machine and the Spectralis were both comparable. So how does the LCHP OCT perform against the other low-cost OCTs? So this is an indigenous built OCT with an automated retinal segmentation software and has a better axial resolution compared to the other OCTs developed by the Song et al. Group and the Kim et al. Group. So in conclusion, I'd just like to say that the OCT is comparable to standard OCT technology. It's portable, economical, it can be used as a screening tool, especially in camp and rural settings, and can also be used for telemedicine and referral from non-ophthalmologists. So I have a short video here which shows how the OCT can be carried in a bag and can be taken to rural centers and even for camp settings. Thank you.
Thank you, Dr. Karishma. Judges, please.
I think it's a great innovative tool, especially for home monitoring or for the rural screening. I just wanted to know what's the cost of this
So it's around 13 lakhs,
13 lakhs. Okay.
which
And
is,
in terms of reproducibility of the images,
so as in,
for follow-ups, how?
yeah, so the machine does have the laptop that I mentioned. It has a USB and a Wi-Fi, and it also has facility to store and share the data. So if the imaging is done at a rural center or a referral center, this can also be shared with a ophthalmologist in the city. So that is one of the features that is incorporated in the system.
So most of the machines do have a follow-up criteria where it takes the data of the previous scans
Right,
and does
yeah.
scan the same area
Yeah.
to give you the comparative.
Yeah, I
Does
don't
this have-
think at this point it's not there, but I'm sure in the future we'll develop the facility as well.
Thank you. Thank you.